Hello, my name is Robert Bache, MedicareBob. I own Senior Healthcare Direct, and in this video, I'm going to share with you what the best Medicare supplement plan is for 2017. I've done this video a few times now on Facebook and YouTube, and I've had a lot of people ask me if I could do it with a slideshow type of format, so that's what I'm doing today. So we're going to start with what are the three most popular Medicare supplement plans. There is the Medicare Supplement Plan F, which I call full coverage, Medicare Supplement Plan G, which I call the greatest value, and Medicare Supplement Plan N, which I call not fixed. Yes, as you notice, I am pretty corny. F, full coverage, G, greatest value, N, not fixed. I find this very helpful for my clients on how to remember the three different plans, and it helps me too. So let's look at the most comprehensive Medicare Supplement Plan F. Plan F, again, I call full coverage. With Plan F, there is no copay, no deductible, and you can go to any doctor, any hospital that accepts Medicare. So F, full coverage, you'll never have a bill basically. As long as Medicare approves the 80%, the Plan F pays the other 20%, so you have full coverage. Medicare Supplement Plan G, this is my favorite plan. I call Plan G the greatest value. All you pay is the first $183 of your first medical bills, and then the Plan G pays everything else. And of course, you can go to any doctor that accepts Medicare. So if you're keeping track, the only difference between the Medicare Supplement F and Medicare Supplement G is that with G, you have a very small $183 deductible. That is the only difference. There's nothing else that's different between F and G, except with G, you basically pay your first two doctor bills. Medicare Supplement Plan N, this is becoming a more popular plan. It is a good plan. I call Plan N not fixed. There's nothing wrong with it, but there are some out-of-pocket exposures, more than the Plan G. With Plan N, you have that same $183 deductible. And then you have up to a $20 copay when you go to the doctor, $50 copay if you go to the emergency room, and you have to pay what's called a Part B excess charge. What's a Part B excess charge? Part B excess charge means that if you go to a doctor that accepts Medicare but charges more than what Medicare allows, then you'll have to pay up to 15% of that if you add the Plan N. And of course, with Plan N, you can go to any doctor that accepts Medicare. Medicare Supplement Plan G is the best for 2017. So why do I like Medicare Supplement Plan G better than the Medicare Supplement Plan F? Well, for me it's easy math. Plan G offers a greater value than Plan F, and again it's easy math. Plan F usually costs around $500 more per year than Plan G. So why pay an insurance company $500 more for an F just so that insurance company can then pay your $183 deductible? That doesn't make any sense. That's a bad deal. You should not choose Plan F. You should choose Plan G. Because remember, this is an annual savings. So yeah, you save $350 this year, maybe $350 next year. Before you know it, you're saving a couple $1,000s over the life of your plan. Why do I like Plan G better than Plan N? I like Plan G because it can still guarantee your health care costs. Plan N just can't. As you know, because we went over it, Plan N has some copays and also requires you to pay the Part B excess charges. So you can't guarantee what that's going to be because you don't know exactly how many times you're going to go to the doctor. You don't know if maybe a doctor you go to will charge more than Medicare allows. So Plan N is a good plan, but I still like G better this year because almost for the same price, you can still guarantee your health care costs. Because with Plan G, as long as you pay your monthly premium, the only bill you're going to have is the first $183. So I like Plan G better than F because it's a greater value. It's going to give you the same coverage but save you money. And I like Plan G better than N because it can still guarantee your health care costs. So Plan G is the best plan for 2017. I wanted to throw this in here too because I still get surprised at how much things out there that people do not know, very simple things about Medicare supplement plans. So I added this slide. This is called Facts About All Medicare Supplement Plans. All Medicare supplement plans offer the same coverage. The only difference is price. So the letter of the plan dictates the coverage, not the carrier. So let's say you agree with me and you want to go with a Plan G. Well, you want to get the best price for that Plan G because it doesn't make a difference to your doctors or to anyone if it's a Blue Cross Blue Shield Plan G or a Mutual of Omaha Plan G or a Cigna G or an Aetna G or Equitable or any of these great companies that offer the Medicare supplement plans. The benefits are identical. The only difference is price. So you should not overpay for it. So find the plan you want and then get the best price. Another one is if your doctor accepts Medicare, they will accept your Medicare Supplement Plan. I come across this so much. I'll help somebody with a Mutual of Omaha supplement plan, for example, and they'll call me back the next day and say, hey, Bob, I called my doctor's office and they said they don't accept Mutual of Omaha. Well, that's because that person kind of asked the wrong question. If you call a doctor's office and ask them, do you take Mutual of Omaha or do you take Cigna or whatever carrier your Medicare supplement is with, they may not know that you're asking about a Medicare supplement. They think you're asking about an HMO, like a Medicare Advantage plan. So that person that works at the doctor's office is checking their HMO list, and then they don't see that company listed because that company doesn't offer an HMO. So if you have a Medicare supplement plan, all you have to do is ask your providers, do they accept Medicare? Because as long as they accept Medicare, they do accept your Medicare supplement plan. Medicare is primary. It does not make a difference to your doctor if it's United Healthcare, ARP, Blue Cross, Cigna, Aetna, Mutual of Omaha. It does not matter to your doctor. As long as you have a supplement, if they take Medicare, they'll take your plan. Here's something else that I still get surprised about. People don't know that you can shop your Medicare supplement plan at any time of the year. Yes, not just in October and November. You can shop your supplement at any time. What that time frame, which is called annual enrollment period, of October 15th through December 7th, that only refers to prescription drug plans or Medicare Advantage plans. If you have a Medicare supplement plan, you can shop that at any time of the year, just like you get rate increases at any time of the year. Okay? So, yes, the reason you're seeing this video now, and hopefully you know this for the rest of your life, is anytime you get a rate increase or anytime you want to shop your supplement, you're allowed to. There's no time frame that you have to stick to on your supplement plan. Here's another one that people don't know. Unless you're new to Medicare, you do have to medically qualify for a supplement plan. A lot of people get confused because of Obamacare or because when they first turned 65, they didn't have to qualify, so they don't think they have to qualify in the future. Well, when you first turn 65, you have 6 months before or 6 months after turning 65 or getting your Part B Medicare for the first time. That's the only time in your life that you're automatically accepted for a supplement plan. If you want to change later, then you have to medically qualify. Now, you don't have to get a physical or blood work. You don't have to be as healthy as a 25-year-old or anything. They usually look for a 2-year stability on your health. And on the application, there's some health questions that you have to answer. And then that's the medically qualifying, is you have to answer some health questions. Also, if you've had the same Medicare supplement plan for more than 2 years, you are overpaying. This is the case with any insurance plan, really. I mean, if you look at your car insurance or homeowners insurance, unfortunately, the insurance companies, they increase their existing policyholders' rates more than they do for new people that join. So if you've had the same insurance plan, including your Medicare supplement, for 2 years or more, then you should call us or fill out the lead form because you're overpaying. It's really that simple. If you've had the same plan for 2 years, you can get the same exact plan now with somebody else for less money. Pricing. Pricing is based on your zip code, age, and gender. Okay? So again, it's zip code, age, and gender. That's how your price is determined. So those are some facts about Medicare supplement plans that I really think you should know. Even if you don't work with us, these are really good things to know. Now, why you should work with us, how we can help. Senior Healthcare Direct, we represent all the top Medicare supplement carriers. We help our clients get the best price. So you fill out the lead form or you give us a call. We save you money now, or if you're new to Medicare, we'll help you find the right plan at the best price, and you get the best price now. So because we represent all the companies, and now you know all the plans are the same, so we'll help you find the plan and then get the best price. We also do what's called annual supplement reviews. So we don't just help you now. We're going to help you every year. Every year, we send you an email and contact you, and say, hey, we see that your policy is up for renewal. Looks like you're getting a rate increase. You have a Plan G, for example. That's a great plan. Let's make sure it's still the best price. And we spend 10 minutes with you to make sure that you still have the best price. If you don't, then we switch you over to whoever does. Annual Part D reviews. This is something that I'm still surprised that people do not do every year, which is look at their drug plan. Your drug plan changes. Every October and November, you're allowed to change your drug plan because it changes. The premium changes, the amount of copays that you have to pay changes, everything changes. So what we do for our clients is every October, we touch base with them, we get a list of their updated prescriptions, and we help them to get the most cost-effective drug plan every year. So our clients never overpay for their supplement and never overpay for their drug plan. Those are two huge reasons to work with us. Credibility. We're A+ rated with the Better Business Bureau. We have over 2,500 likes and positive reviews on Facebook. We have over 7,500 happy clients. And we get, out of our new clients every month, 30% are referrals. And you know who the owner is. I'm Robert Bache. If you've Googled me, MedicareBob, I've been on the news. I've been helping people for the last 8 years. I've owned my own business the last 4. And we do things the right way. Okay, again, we do things the right way. We're going to help you get the best price, best value every year, and we provide great customer service. So I do encourage you to fill out the lead form. If you have friends on Facebook that are watching this, or you want them to see this, share this on your page. It's just valuable information, even if they don't work with us. These are things they should know, so you can help them save money. So please like, comment, share, and also fill out the lead form. We'll contact you, and we'll help you get the right Medicare plan for the best price.